All righty. Are we in?
And be cozy.
Yeah, we're close together.
Okay.
It's all
And
right.
then I'll pull up the questions here, so they'll be right here. And then can you lean it against this? Will that work?
Maybe I don't have a case, so
I can get you whatever we need to.
will that work?
Yep.
All right, we're in.
All right. Hey guys, Dr.
Hey.
Jarod, Dr. Diego. We are here a little early tonight because someone has some dinner plans with family. So we're starting getting it rolling. Okay. So if you're joining later, sorry, but I'll always post it. You can always go back and watch what we talk about. So Monday nights, I always put a box Sunday and Monday so you guys can submit your questions. And then Monday night, 7 p.m. Eastern time, most weeks, I'll let you know if it's not happening. I answer your questions for free because I don't have time to keep up with my DMs sometimes. So this is an option for you to ask your question and lots of people to learn from it. Don't worry, it's always anonymous unless you want me to say who you are, but I probably won't. So anyways, I'm super excited to have Dr. Diego here on the live with me, our new rising star chiropractor at the clinic. So we're just going to jump right into it. Tonight's theme is nervous system and chiropractic with a little razzle dazzle sprinkled throughout. Okay, so we'll start here. Dr. Diego, give us the 60-second version of who you are and what led you into chiropractic.
Okay, sweet. Hi, guys. I'm Dr. Diego Torres. Nice to meet you all. Well, who I am, I'm born in Puerto Rico, and I grew up here in Central Florida. And I studied biomedical science at UCF for undergrad. So I knew I wanted to be in the health field, but there was something in me that just didn't feel like I wanted to chase pain or chase symptoms and then just prescribe a medication. And I said, okay, well, what is the best way to go about that? And then chiropractic from there was just, a full send. It didn't hesitate, not once, didn't turn my mind, didn't turn back. And I love what I do. It's phenomenal to help people out and not just, chase the pain.
Cool. All right. And then what brought you to Fort Myers?
Oh, what brought me to Fort Myers is my absolutely beautiful fiance is pregnant and she wanted to have her, we wanted to have the baby closer to her family, and her family is based out of here. So that's awesome. Baby number one, Luca, I can't wait to meet you.
Oh, it's a great reason. Cool. All right, sir. So chiropractic, awesome. What was a moment in your life that made you realize the nervous system was everything?
Okay, yes. So I had a patient come in, and they were coming in specifically for low back pain. And not only did we get the low back pain to resolve, the body healed itself entirely. And she noticed just her systems felt better, less fatigue, better sleep throughout the night, less tension around the neck. Her mind wasn't racing, all because she came in just for her low back. So that's how I knew that the nervous system, I said, there's something more to it than just your back pain.
So she came in for one problem and you fixed like 7 of them.
That's when it clicked.
Well, her nervous system fixed 7 of them.
I didn't do any healing.
Right. Just brought it all together.
That's the way.
Nice. Okay. So what's something patients may be surprised to learn about you?
Okay, sweet. So I love sports. I won't miss a single Packers game. And I love going to the gym and all that, being athletic, playing sports and all that. But I'm probably the biggest nerd you'll ever meet if you get to know me.
Awesome. Cool. What's something nerdy?
What's something nerdy? Yeah. Oh, gosh, way to put me on the spot. Let's see. I can name all 12 of the cranial nerves. That's pretty nerdy.
Awesome.
Yeah.
It's important.
Yeah.
Okay, cool. So, all right, we're talking about nervous system. We're talking about chiropractic. When, a lot of times people throw around the term nervous system based chiropractor, including myself. But what does that mean to you? What does that actually mean?
So what that actually means to me is I'm not necessarily chasing pain. If you come into me with a specific problem, what have you, let's say your neck hurts or your back hurts. Yes, not that I'm ignoring it, but I think that there's a deeper underlying cause as to why it's hurting in the first place, and some things that could be going on in your body that you might not even be interconnecting to that. So that's what being nervous system focused means. Not necessarily chasing the pain, or only caring about the part of your body that hurts.
Got it. Cool. So like, what's an example of like nervous system care? Like, what, I guess my question is like, what would someone expect in their life from a better regulated nervous system?
Oh my gosh, absolutely. That is so many things you will notice. Some of my top three, I would say, is less mind. When your mind is, you feel like it's always racing, you can't shut it off, you difficulty falling asleep, you just get stressed or anxious and worked up about things that you shouldn't necessarily be getting stressed about. Finding that to ease, that's a huge factor. Another thing is just tension around the head and shoulders and the neck. You just feel always tight, difficulty to take a big deep breath, difficulty to just relax, especially when you're in a relaxed setting like your room or at your house where you should feel safe.
Not adapting.
Right? Yeah, not adapting.
Not matching the vibes.
Correct.
Okay. How is your approach different as a chiropractor from what people think of, back cracker?
Okay. Yes. Everybody loves the crack. Everyone loves to hear the sound. Yeah. So my approach is different because although we do get kind of, like a rush or wow, that adjustment was corrected when you hear the crack, we're not necessarily chasing the crack. That's honestly just gas being released. What my approach is, like I said, more so nervous system based. So just because you have a problem going on in your elbow, for example, it doesn't necessarily mean that it's coming from the elbow and I need to get your elbow to crack. It might be coming from something deeper rooted, maybe at the nerve root or at the cervical spine, where the nerve that travels through to get to the elbow has to go to.
Cool. So how would someone know that their nervous system needs some help and that it's dysregulated? Like maybe give us the top 3 signs.
Okay, top 3 signs is, I kind of touched on it a little earlier, more so just your mind always racing and you feel on edge. So we have the sympathetic nervous system and the parasympathetic nervous system. Sympathetic meaning your fight or flight, parasympathetic meaning your rest and digest. That's a very, top of the mountaintop of that one. But when you're constantly in that fight or flight zone and, you just can't relax, that's a huge factor. Number 1. Number 2, tension in the shoulders and the back, kind of feeling always braced or just on edge. And number 3, always feeling like you're trying to take a big deep breath, but you're not getting the oxygen. You can't take a breath.
Okay, cool. How, just to add to that, you might see like digestive dysfunction, right? Maybe you're constipated or you're having too many bowel movements, right?
Yeah.
That would be a sign of like your nervous system not functioning right. Maybe you're bloated, right? Maybe you're just like, you've been in fight or flight for so long, you're beginning to be fatigued and you're getting brain fog, right? So a lot of times, in our patients, we see as they start getting adjusted more regularly, as we start combing through those tangles and kind of like brushing the nervous system, making it nice and clean, brain fog is one of the first things to leave, right? And then like, if you're really fatigued, I would say that's another sign of nervous system dysregulation, right? Because whenever you get adjusted, it helps organize the body, right? It helps organize the neurons and the nervous system. And when you have more organization, there's less wasted time and energy, leaving more energy for you to live your life and have normal function, right? So those are some things too, where like everyone comes in, they want more energy, they are brain fog, their digestion's off, they have some pain, they're tight, they're tense, like they flip out they trip at the smallest things, right? Those are all collectively, the nervous system needs some love, right? So great, I love that. Tell us a story. What's a case you'll never forget and why?
All righty. I love this story and I love when I get asked this because this was my very first case, the first case that I got as a doctor after graduating. There was this one patient who just could not get over her vertigo, dizziness. Her world was spinning. She never felt like she was able to sit still. Her eyes were constantly moving. She was, in her words, a train wreck. And long story short, just after about 3 months of care it took for this, she says, "Hey Diego, I want to show you something." She gets on the floor, lies down on her back. She wasn't able to lie on her back. She always had to be on her side. Lies on her back and then stands up. Something as simple as that. And then she started crying, saying that, I can't believe I honestly thought that this was it.
Yeah.
And yeah, that's probably my favorite case ever, when I had my first patient go down to the floor, lie on her back, and then stand back up.
Yeah, cool. It was emotional.
Yeah,
for
it's
her,
pretty
huh?
sweet.
Sweet. So we have a lot of female clients, a lot of female patients, usually because they're the first to notice about something is wrong with their bodies and the first to take action. Guys tend to just deal with it a lot longer than normal until it's like really disabling them. So anyways, a lot of women in our practice, I would say, deal with chronic stress and exhaustion. How does that show up in your care?
Yeah. So how do I know that a woman is feeling very dysregulated? Well, they're pretty intuitive, so they kind of know to begin with. But some signs that they notice is tension and tightness around the jaw, uh, pelvic floor instability, um, difficulty digesting things that you would have normally never had problems with, and just changes in mood that she herself realizes. These are just very surface level things, but a few of them that a woman would realize when their nervous system is dysregulated.
Like irritability.
Irritability, yeah, irritability. Getting upset at things that just wouldn't normally upset them.
Right.
Out of the norm.
Okay. All right. So when you're taking care of a patient, what is a clue that tells you someone should stay under care long term?
Under care long term, two things. Number one, if they're responding well to care. If they're responding well to care, why would you stop?
Right.
Number two, I'll answer that one with a question. How long do you take care of your teeth? Do you brush them once in your lifetime and then your teeth are good to go, or do you brush them hopefully twice a day, unless you don't care about your teeth? So yeah, kind of everyone should be under care for a long time.
I agree. It's part of a lifestyle, right? It's not just a problem fixing. It's building health with every adjustment, right? Hygiene, right? You can replace your teeth, but you can't replace your spine.
This is true.
Okay. And then last question is targeted towards you, sir. What's one sentence you wish every patient could hear before walking in?
I love this one. One sentence that I wish everyone could hear is, your body is not dumb.
Yeah.
You are able and capable to deal with what you are going through, and not everything is resolved with a pill. Your body wasn't made incorrect. Your body was actually made perfectly. And your body isn't dumb. You can get through what you're going through. That's one thing I wish everybody knew. You're a self-healing creature, and that's an indisputable fact.
That's good. Yeah, it's like I kind of like to think like every adjustment gives the body clarity, and then it knows what to do, right? The problem is not that your body doesn't know what to do. The problem is that your body sometimes lacks clarity, and then every time you get an adjustment, right, it clears that nervous system. It provides clarity, so the brain's like, oh, that's what's going on. Okay, now I can take some steps toward healing. And then things get muddy again because you get stressed. You get in a fight with, an argument with your loved one. You eat a lot of, you drink, you eat a lot of bad food, blah, blah, blah. Anyways, excellent. Yes, God made your body amazing. It knows what to do. It just needs a little bit of clarity. Cool. Okay, a couple other questions from you guys that you submitted Sunday and Monday. Super awesome. Someone asks, can THC drops cause a panic attack for 3 hours and dysregulate the nervous system? Absolutely. Yes. So, it's a stimulant, right? It's targeting the cannabinoid receptors in the brain. And so if your nervous system is fragile, you may not, first of all, it's a controlled substance too, right? So you don't necessarily know how each person is going to react. And then it's targeting the cannabinoid receptors in the brain. And it can lead to dysregulation. Absolutely.
Yeah, one thing just to piggyback on that is just because that it does get dysregulated, especially from a plethora of factors, right? In this situation, the THC drops, it doesn't mean that it's stuck there, right? Like the body is smart and capable of adapting and getting back into a regulated state.
Of course. Doesn't mean you should keep dysregulating it that way, but of course the body can heal. Right. It has its limits, but yeah. Okay. Someone asked, how do you identify the origin of lower back pain when a lot of times medical doctors don't even know for sure? Go for it.
That's a great question. All right. So one thing, a lot of people like to go and get images for certain things. Like, okay, I want to see why it hurts, right? Like an MRI of the back or an X-ray of the back to see what the structure looks like. Now, I do love images because it does give us an internal view of things and what's going on. But you have to remember those images, they don't show function. They don't show what is happening as you move, as you're sitting, when there's gravity involved, right? So there, it's with low back pain specifically, it's multifactorial. So it's very difficult to pinpoint one exact thing. There's a lot of stabilizing muscles in the back, core muscles in the front, muscles of the legs that could all play a role into it. So the best way to identify the origin of it is, as cliche as it sounds, is come in and get checked.
Yes, we have really specific neurological tests where we can figure out exactly which segment of the spine is dysfunctional. And when we find that dysfunction, when you correct the dysfunction, it can begin alleviating the pain, not only because we're alleviating pain, but because we're restoring health. And when health is restored, you can't really have dysfunction, right? So, and a lot of times, for whatever reason, primary care doctors or whatever, they just they probably are trained in those tests, but maybe not to the extent chiropractors are, and or they just prescribe a muscle relaxer because they're not going to do any manual therapy like we will, which is fine. That's why we have different targets. But yeah, that's what I would say. That, like, for example, if you take your big toe and you pull it back towards your head, and then I push down on it, like push it away from you, and you can't hold it, that is the only nerve in the back that is connected to that muscle is L5. So if it goes weak on the right or the left, I know you have an L5 problem, right? And that's the last vertebra in your low back. So there's a bunch of different tests like that for the entire spine, and we have those memorized. And so we can then figure out exactly, not only we can have the imaging, maybe it doesn't really show a whole lot, but we really care about neurological dysfunction. What nerve coming out of your spine is not making it to the end point so that you have a balanced and full life, right? So lots of different tests. Great question. Someone said, coffee overstimulates me and I get internal shakes now. Any other options when feeling tired? Okay, so I'll answer this question. Well, I know who you are. You're my patient. I know your nervous system is fried, and we're working on it. Hi, Brandon. He says hello.
What's up?
I think you don't need stimulants. I think you need to focus on rest and recovery, honestly. If you need more energy, we need to get more nutrition into your cells so that they're producing more energy on their own, because caffeine is putting your nervous system into the danger zone, because you're then getting internal shakes and anxiety, and that's not cool. So, you could try things like ashwagandha. We really need to heal your adrenal glands, so I would look into licorice and rhamania, and those are found in a combination called adrenal complex. But those are some certain things. Also, first thing in the morning, drink some water with some like pink Himalayan salt or Celtic sea salt in it. That will really help bring hydration to your brain and to your nervous system. And guys, I've noticed my heart rate variability, if you ever track that. But heart rate variability, when you increase your water intake and your mineral intake, it helps your nervous system have more depth and resilience just with hydration and minerals alone, right? Someone says they love ashwagandha. Yes, it's amazing because it nourishes not only your hormonal system, but your nervous system. And ashwagandha actually helps your blood sugar stay balanced as well. So it kind of hits 3 points, which is really awesome. And it's usually pretty affordable and very well known. So that's a good clue. Someone says, my nervous system is always, all caps, always in overdrive. Why? And then how do I fix it?
That's a great question. So why? There's three things, right? Emotional stressors, physical stressors, and chemical stressors. Physical stressors, that's an easy one, right? That is anything physical going on, right? Slip, fall, trauma, blunt trauma,
Slouching,
postural. These are all physical factors. Emotional, that one could be relationship with yourself, relationship with others, could be romantic or just friendly. This could also be a stressor. And then last one, chemical, that is, let's see, the food that you eat. Let's say you're going out and eating processed food every day. Let's say that, here's a good one. Let's say you just moved somewhere, you're feeling great. 8 months down the road, you start to feel a little lethargic. You're just feeling a little off. You do a mold test, boom, there was mold in the walls, right?
Mhm.
So these are the three kinds of stressors that are going to in-laws. Yes, that one I would say
So-
that one is an emotional stressor as
It
well as a
can be,
physical
right?
and a
It
chemical.
can be.
Yeah. So these are three things as to why your nervous system is in overdrive. Kind of, you know, uh, being in overdrive meaning the gas brake is always down, and then relaxing is when the brake is on. This is kind of like the gas pedal is floored. Those are the three things that would cause it to be in overdrive.
Mhm.
How do you fix it? The chiropractic adjustment,
Mhm.
changes in lifestyle, nutrition, and yeah, that's the gist of it. But
Mhm.
that is why and how to fix it and
Yeah.
correct it.
Well, how does the chiropractic adjustment fix it?
How does a chiropractic adjustment fix it? So, not to get all nerdy on you guys, as I said I was, the brainstem is a very important part of the nervous system. It helps control literally almost everything.
Mhm.
When there is a misalignment, let's say degeneration of the spine itself, malposition, inflammation, what have you, it puts pressure on said brainstem, and that does not allow the body to regulate itself as it normally would have. For example, when you were a kid and you didn't get the toy that you wanted, your nervous system was dysregulated, but then you get the toy and then you feel fine, right? It's not as easy as that as an adult, but that's just a factor that shows, hey, your body's smart. It can regulate itself. Sometimes there's just external factors that are preventing the body from doing that.
Cool. Nice. Last question tonight, unless someone else asked a question. Don't think so. Let me just double check. Don't think so. Someone said my nervous system is under attack since I removed my breast implants. I'm working on healing. It's by far the hardest, and I struggle with lung issues, but by far anxiety and panic attacks are the worst feeling than my chronic lung condition. Okay, so just kind of like what Diego was saying, is like stressors piling on top will eventually, break the camel's back, right? And the camel's back being your nervous system, and now it's dysregulated. Well, surgery, the body interprets as a physical trauma, right? So if you already have a lot of emotional things going on, your body is already toxic, because if you ever heard of breast implant illness, there's usually a lot of toxins associated with those types of, it's a foreign material in your body, right? Sometimes that can go okay. Most of the time it does not. And so there's probably already a chemical stressor or a toxicity stressor. And then when you go and you have a surgical removal, that's a physical stressor. And that could have just been the thing that just like made your nervous system be like, I can't do this anymore. Right. And so what you need to do, there's a technique that I do called injury recall technique. And then also what it does is it basically, you tell the brain now is like, has PTSD. It's like, oh my gosh, you cut me right here, right? I can't deal with this anymore. This is wounded. Oh my gosh, blah, 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 right? Injury recall technique helps the body go like, hey, this happened in the past. It's no longer happening. We can move forward. And the brain's like, oh, okay. This is no longer a current wound, a current physical stressor. It's a past stressor, and I can move forward accordingly. So that's, to me, when I read your question, probably what happened. Dr. Wally Schmidt, who was an AK doc, he taught about this technique. And, but anyways, so fixing the area of irritation in the peripheral area of the body, right? So area not in the spine, and then going back to the spine, delivering adjustments to help the spine and the nervous system calm, communicate, right? It just helps restore that computer system of the body so it no longer feels like it's on fire. So that's where I would start looking at with that case. I think you need to come in and see us if you're local, or find someone near you that can help kind of unravel the internal alarm that you're experiencing. So did you have anything to add to that, Diego?
No, I think you hit it on the nail. Yeah, I
Okay.
couldn't say it any better myself.
Okay, yeah. Awesome. Cool. Well, hey guys, this is Dr. Diego. We're going to have him on, probably a few here and there. So wish him a warm welcome. If you're in Fort Myers area, he is awesome. He adjusted me today. I feel great. I've been telling all my patients this. I would trust my mom to him he would take care of my mom if she was local. And I'm proud that I can say that honestly enough. And it's just great to have a good doc to send people to. So welcome, Dr. Diego. Thanks for joining us tonight, guys. Hope you have a great evening, and I'll see you next week.
Peace.
Sick. Bye, YouTube.
Adios. Sorry, that was fire.